Do you think a toothache is just a dental issue? For people over 60, it could be the very first silent warning sign of a heart attack. That's because heart attack symptoms don't always show up in the chest. Sometimes they start quietly inside your mouth. I once handled an emergency case at 2 a.m. A 68-year-old woman came to her dentist complaining of a dull toothache. Just 30 minutes later, she was rushed to the cardiology unit with a full-blown myocardial infarction. What haunts me is this. It wasn't the first time I'd seen it happen. Most people don't realize that the early signs of a heart attack can begin in the jaw, the tongue, and even the gums without any chest pain at all. For seniors, these heart attack warning signs can be subtle, vague, and dangerously easy to ignore. In this guide, I'll help you recognize the top 5 oral signs that may point to a heart attack. How to tell them apart from typical dental issues, and what to do when they show up so you can prevent a heart attack before it strikes. Why does a heart attack start in your mouth, not your chest? When we think of a heart attack, most of us picture intense chest pain, maybe even the feeling of something crushing our ribcage. But here's what most people don't expect. Especially in older adults, the first symptoms don't always come from the chest. They can begin in the mouth jaw or even the neck. According to studies from Cleveland Clinic and Harvard Medical School, up to 30% of heart attacks in women start without chest pain. Instead, they experience jaw tension toothaches or persistent dry mouth symptoms that send them to the dentist instead of the ER. This happens because of a phenomenon called referred pain. The nerves in your chest, jaw, and neck are all part of the same signaling system. So when your heart muscle lacks oxygen, the pain doesn't always stay local. It can travel to places like the left lower jaw or even the tongue. That's why this is one of the early signs and symptoms of heart attack often overlooked. What's more, in people over 60, especially women, heart attack symptoms in ladies are often vague, masked as fatigue, anxiety, or minor dental discomfort. That's why recognizing them early and correctly can save your life or the life of someone you love. So, which symptoms inside your mouth could be silent heart attack signs? Below are 5 early signs of a heart attack that often get missed, but catching them in time could be your best chance to prevent a heart attack. Sign number 1. Dull pain in the lower left jaw. Your heart's quiet cry for help. Do you feel a persistent, nagging ache in your lower left jaw? It doesn't seem tied to chewing. There's no tooth decay, and painkillers don't help. Don't brush it off. This may not be a simple dental issue, but it is one of the early warning signs of a heart attack. This is known as referred pain when your heart lacks oxygen. The brain sometimes misinterprets where the pain is coming from. According to the Mayo Clinic, heart attack symptoms in women are more likely to show up in the jaw, neck, or back rather than the chest, as is familiar with men. Many people describe it as a toothache that just won't go away dull deep, sometimes radiating toward the ear or upper neck. The problem, after a clean dental checkup, they assume nothing is wrong until the heart attack strikes. Pay attention if the pain isn't affected by chewing, talking, or biting. There's no sign of cavities infection or gum disease. It's paired with fatigue, cold sweats, or shortness of breath. If you or someone over 60 is experiencing this, don't wait. See a doctor and ask about the possibility of cardiac evaluation, because heart attack symptoms don't always come with obvious chest pain. The damage to the heart may already be underway. Sign 2. Unexplained toothache. When there is no cavity, but the pain persists. No cavity. No sensitivity to hot or cold. No swelling or infection, yet your tooth still aches persistently. This could be a silent alarm from your heart and one of the heart attack warning signs most often overlooked. Some patients come in complaining of pain in a single tooth, most commonly a lower molar on the left side. But after careful examination, the tooth appears completely normal. The pain only pretends to be a dental issue, while the true cause is much bigger. Heart attack pain radiating through nerve pathways. Studies from Harvard have shown that reduced blood flow to the heart can trigger nerve responses in the jaw and face area, creating the sensation of toothache even when no actual dental problem exists. This is the type of pain that no painkiller can resolve, except by treating the underlying heart condition. You should be cautious if the pain occurs at night or after an emotional event. There are no signs of tooth decay or gum inflammation. It is accompanied by mild chest tightness or lightheadedness. Signs before a heart attack are often subtle like this. They are not loud or severe, but if ignored, you may miss your window to survive. If you have seen your dentist and no clear cause has been found, do not hesitate to visit a cardiologist. It could be the first signs of heart attack your heart is desperately trying to send you. Sign number 3. Tightness, numb gums, or tingling lips. Your heart's faint warning call. Some patients describe it like this. It felt like someone was gently squeezing my mouth. Or, my gums felt numb, like they fell asleep. Others report a tingling sensation around the lips, or a strange tightness without any apparent cause. These odd feelings might come and go in minutes, but for older adults, they could be early signs of a heart attack. Why does this happen? When blood flow to the heart drops, the body reacts by narrowing blood vessels in distant areas like the mouth lips or jaw. That sudden vasoconstriction creates sensations of pressure, tingling, or even mild burning, especially in the morning, after light physical exertion. Unlike numb lips caused by cold or low blood pressure, this kind of tingling often shows up without dizziness or changes in posture. It may occur on its own or alongside subtle symptoms such as fatigue or changes in heart rhythm. Red flags to watch for. Gums or lips feel flat or unusually numb. There are no signs of infection yet. There's a noticeable tingling. The sensation appears while resting, not during cold exposure or movement. According to cardiologists, this is one of the most overlooked signs of a heart attack. Many patients later recall, "Now that I think about it, I did feel something strange there." But by then, the damage had been done. If you've experienced any of these odd sensations even once, and especially if you're over 60, don't dismiss it. A quick heart checkup could make all the difference, because heart attack symptoms sometimes whisper instead of shout, and they may only do so once. Sign number 4. Persistent dry mouth and bitter taste. Your body's severe warning. Do you feel like your mouth is constantly dry, or your tongue has a bitter metallic taste, even though you're drinking enough water and haven't started any new meds? Most people blame it on stress aging or just feeling off. But for adults over 60, this could be one of the heart attack early warning signs. Here's why. When the heart isn't getting enough oxygen-rich blood, it can disrupt the autonomic nervous system, the one that controls involuntary processes like saliva production and taste perception. As a result, you might feel a strange dryness in your mouth or a lingering bitterness near the back of your tongue even when your dental health is perfectly normal. According to research from Harvard Medical School, this symptom often shows up before a silent heart attack. This dangerous event happens without any of the classic chest pain, but still causes severe heart damage. What to watch for? Dry mouth that doesn't improve with hydration. Bitter or metallic taste that won't go away. Paired with fatigue. Insomnia or unexplained restlessness. These symptoms might seem harmless, but especially for women whose heart attack symptoms tend to be more subtle than men's, they can be life-saving clues. This kind of oral discomfort is listed among the silent heart attack signs in older women. So if you've noticed a persistent bitter taste, or your mouth feels dry for no apparent reason, don't just chalk it up to stress or diet. It could be your heart's first whisper for help. Sign number 5. Tongue pain or pinprick sensation. A tiny symptom you shouldn't ignore. Have you ever felt a sudden sting on the tip of your tongue like a sharp needle jab, even though nothing's wrong with your mouth? Maybe your tongue burned slightly or lost its sense of taste for a few minutes, seemingly out of nowhere. While rare, this might be one of the early signs of a heart attack. Why would your tongue be linked to your heart? When blood flow to the heart is disrupted, it can trigger overactivation of the sympathetic nervous system. This causes chain reactions throughout the body, even in places you wouldn't expect, like your face, neck, and tongue. That sudden tingle or burning on your tongue without any visible cause might be a subtle warning sign of a heart attack. According to clinical reports in the U.S., over 12% of minor heart attacks in older adults were found to involve neurological symptoms in the mouth, particularly tongue numbness, altered taste, or unusual oral burning sensations. What to watch for? Sharp or tingling pain at the tip of the tongue. Burning or prickly sensation without visible sores. Accompanied by fatigue. Lightheadedness or a racing heart. If you're experiencing jaw pain. Unexplained toothaches, dry mouth, tingling lips, or a sharp pinprick-like sensation on your tongue. Don't be too quick to chalk it up to dental issues. For those over 60, these could be early warning signs of a heart attack, especially when paired with fatigue, shortness of breath, cold sweats, or sudden unprovoked anxiety. When symptoms like these show up in the mouth and routine dental exams find nothing wrong, it's time to look deeper. Heart screenings like an ECG, cardiac enzyme tests, or an echocardiogram can help detect a silent heart attack, the kind that doesn't come with dramatic chest pain, but still damages the heart. If you have underlying conditions like diabetes, high blood pressure, or high cholesterol, early detection is critical. What seems minor might be the only signal your heart is sending before a serious event. Don't wait for a full-blown heart attack to take action. Take steps now to protect your health. Eat better. Cut back on sugar and unhealthy fats. Stay lightly active every day. Get enough sleep and monitor your blood pressure regularly. If you're on multiple prescriptions, talk to your doctor about switching to heart-safe medications and be cautious of dangerous medications for the elderly that could silently strain your heart. Because sometimes a heart attack doesn't come crashing in through your chest. It knocks quietly from inside your mouth. If you found this information helpful, please share this video with your parents, loved ones, or anyone over the age of 60. Because just one small sign, if caught early, could save an entire heart. If you want to understand heart attack symptoms, better learn how to prevent strokes or take charge of your health as you age, don't forget to subscribe to this channel. Prevent a heart attack not by living in fear, but by understanding it clearly and acting promptly. Thank you for watching. I'll see you in the next video.